And welcome back to the second hour of our program. Thom Hartmann here with you, broadcasting live from coast to coast. Edmund Heiselmeyer is with us. He is the Senior Research Fellow in Health Policy Studies and Domestic Policy at the Heritage Foundation, heritage.org, the website. Edmund, am I pronouncing your name right? Sean, I'm sorry. Edmund, hang on just a minute. I forgot to put you on the air. My fault.
Oh, okay.
Am I pronouncing you right?
Yeah, Heiselmeyer is correct.
Heiselmeyer, thank you very much. You have written a piece, or actually I guess it was Robert Moffat wrote a piece for the Heritage Foundation talking about this 8-point plan and raising some concerns about it. One, you note, or the Heritage Foundation notes there, that so far what we have depends on raising taxes and saving money largely through administrative payment changes in existing entitlement programs. That's not exactly fundamental reform. I think we can agree on that, although isn't it an appropriate starting point to fix the stuff around the edges?
I'm not sure it is. In fact, I was thinking about this the other day, and I may actually write something on this, that President Obama may have actually got himself off on the wrong foot by putting more money on the table, because in effect that tells the interest groups, hey, we don't have to worry about reform, it's just going to be more of the same.
Well, this is one of my big concerns too, and in fact apparently in his meetings he's not including people who are representing single-payer health care plans, which is what I advocate and what I suspect you view with horror. But he's going to try and walk this middle ground. And I think if you walk the middle ground, you're going to get eaten alive by billion-dollar insurance companies.
Yeah, well, it's not the insurance companies that are the issue, really, in my view. The issue is really the providers, and particularly...
You mean the doctors?
Yeah, but particularly the hospitals.
The for-profit hospitals.
No, it doesn't matter whether they're for-profit or not-for-profit. They all behave the same.
Yeah, by and large, you're right.
No, they do, and this is based on the work that I did with the folks in Massachusetts, and then I've been working with a lot of different states on this, and my observations on this are that 90% of this is interest group politics, and part of the reason that I would attribute Massachusetts to succeeding in being an innovative reform that achieved goals that both the left and the right want is that they were starting from a point of saying, well, we have to do better with what we're spending now.
But from what I'm hearing, Massachusetts is not succeeding.
Oh no, it is succeeding. I mean, it's a good grief.
There are more people insured, but this is nothing close to universal health care yet.
Well, actually, it's incredibly close. It's closer than anybody else in the country. In fact,
what about Hawaii?
I think it's actually closer than Hawaii because of a number of factors there. But they have had a remarkable improvement in terms of the insurance coverage. They enrolled in Medicaid and SCHIP 97,000 people who were eligible but not enrolled. They have provided coverage to 175,000 people who were not eligible for those programs but are still below 300% of poverty through the Commonwealth Care Program. They have a further 200,000 who have simply taken up private coverage that they had access to but figured, well, if somebody else will pay when I go to the hospital, why bother?
Right.
And there,
so it's
the
a start.
Is that
why
they're running out of people to insure in that state?
Yeah. And many of these are government programs, which I would assume, being with the Heritage Foundation, you would be opposed to.
Well, not per se. I mean, again, this is the question is what kind of a system are you trying to create? And
right.
If you're setting about reform, what kind of system are you trying to create? My view, and that of my colleagues here at the Heritage Foundation, is that we want a patient-centered, value-maximizing system. Now, what does that mean? That means that right now in the system, everybody else's interests come first ahead of the patient's. The employers who buy the insurance, the government who runs the insurance program for those who have a government program, they run it their way, the doctors, the hospitals, et cetera. The insurance companies who work for either the government or the employer. We want a system that says, hey, all of you people have to work for the patient.
Right. Well, the insurance companies actually don't work for the government or the employer. They're paid by the government
Well,
or employer. They work
that's
for their stockholders. That's the problem.
Well, okay, but at the end of the day, do you work for your stockholders? Do you work for your customer? You could say that about any business. The point is, if you want more customers, you do what the customer wants. And so, when an insurance company works for the government or the employer as the customer, what the customer wants is to spend less. Well, if there's easy ways to spend less money in healthcare, don't pay for it, or pay the docs and hospitals less. But that's not what you or I want. We want better value. We want to say, well, wait a minute, I want good care at a good price.
What about starting out? Let's back up just a little bit
Yeah.
here and take this to a larger picture. We're talking with Heritage Foundation Senior Research Fellow in Health Policy Studies, Edmund Heiselmeyer, and heritage.org, of course, the website. In the Declaration of Independence that Rush Limbaugh so badly mangled and attributed to the preamble of the Constitution this last weekend at CPAC, where I was actually, not at that particular moment. I managed to avoid his speech, but I was there doing my show on Thursday and Friday. Thomas Jefferson took John Locke's famous phrase from his second treatise on government, life, liberty, and private estate, and changed it to life, liberty, and the pursuit of happiness, and wrote it into the Declaration of Independence as a fundamental right, as one of the reasons why this country was founded. If we were to assume that the right to life is a fundamental right that should be protected by our government, protected by the Constitution. It's one of our rights just as real as our right to free speech and our right to privacy, our right to a speedy trial. The right to life, even though it's not enumerated in the Bill of Rights, as Alexander Hamilton wrote so eloquently, and I think it was Federalist 84, just because something isn't in the Bill of Rights. In fact, he didn't even think there should be a Bill of Rights because people might think that those were the only rights we had. Doesn't mean that it's not there. If there is a right to life in the United States, shouldn't there be some absolute minimum baseline where if anybody in this country gets sick in any way under any circumstances, they can get well, that after all being life, they can get well at essentially no cost or very little cost to them, regardless of their economic station. Are you willing to agree with me on that point?
No, there's a lot of things that you have a problem with on that, because how do you define get well, given that we're all eventually going to die of something?
Sure.
How do there's a lot of definitional issues with that.
Well, let's say if you're 35 years old and you get appendicitis.
Well, let's back up into the practical reality. The practical reality is, because we have this sort of academic debate over health care, and I get asked this all the time.
Well, actually, this isn't academic. I'm just asking, do you think that there's a right to life in the United States? Is there a right to health care in the United States, or is it a privilege?
Well, and again, that's what I say when I get asked that. Is I say, look, that's not the way I would put it. What I would put it is it's a desirable social good. In other words, we want to have health care for ourselves. No, that's not privilege. There's a difference. We want to have health care for ourselves, and we want everybody else to have it too. And I think we can agree on that without getting into a debate on a philosophical conception of right.
No, this isn't some airy-fairy philosophical thing, Edmund, because if we start with the premise and start at law with the premise that health care is a right, then the way that the government approaches health care becomes very different than if we start with the premise that it is a desirable social good, to use your phrase, or a privilege, to use the phrase of some of the people in the Republican Party.
Well, I don't think that they use the phrase of privilege, but what is it a right to?
Several of them have on this show.
Well, what is it a right to? You're right. You do approach it a different way. I'm just not sure that you get something, health reform out of it.
Well, in the minute we have left, how would you best accomplish this, in your opinion, at Heritage Foundation?
Well, what I would envision is a market in which the insurance companies work for you and me. You pick them. They become your agent in what you want, which is, okay, I need medical care. What's the best for me?
What if you have a pre-existing condition and all of them say, sorry, I'm not going to take you?
No. This is a reformed market where they would have to take you, just like they do an employer market today. But they work for you, and your interest is in getting better quality care at a better price, and you're picking them based on, well, what are you going to do do for me. So they become your agent in doing this. And then I would be happy to use any one of a number of different means to extend that to everyone in the country by making sure people can afford it.
Yeah, but you want to keep the health insurance companies in business.
Well, I want to keep them working I want them to work for me instead of the employer.
Right, but the market there. I get it. Edmund Heiselmeyer, the website heritage.org, Senior Research Fellow in Health Policy Studies. Edmund, thanks a lot for dropping by today.
Okay, thank you.
Great conversation. Our number, 866-987-THOM. We'll be right back.